Hello, everyone. Welcome back to another episode of the MSNS podcast. I am your host, Ryan Lim.
And I'm your co-host, Alan Tan.
And today with us is a very, very special guest. His name is Matt Luciano. Do you want to introduce yourself?
Hey everyone, my name is Matt Luciano. How's it going, everybody?
Yeah, so Matt graduated from USF in 2013, and he is currently a assistant nurse manager at the Palo Alto VA. And, before we get into, that part of your, profession and what you've been doing now, I kind of wanted to take a step back and, look into your past and your nursing journey to see, how you got to where you are now. So, yeah.
Okay.
So from my understanding, you started out, once you graduated from USF, you went into a SNF, right? The skilled nursing facility. Can you talk a
Yeah.
little bit about your time there?
Yeah. So pretty much after I graduated in 2013, it was kind of a weird transition, especially as a new grad, because um, pretty much like right after I graduated, my grandpa actually had like a heart attack, and I was actually his kind of like the primary caregiver at that time, and so. Um, at that time, I wasn't really like prioritizing finding a job. I was more so like worried about my grandpa. So like for that past 6 months or probably even more than 6 months, I was just taking care of my grandpa. And so I was pretty much like past that like new grad window. So, a lot of people, a lot of hospitals were actually looking for, nurses for with at least like 1 year of experience. And also the new grad programs, I guess like kind of expired for me. So the only opportunity I had was like, go through like a skilled nursing facility, and that's kind of like what I did. So I worked for a skilled nursing facility for about 6 months, and to be honest, it wasn't as bad as I thought it would be. That experience actually taught me a lot of, great skills as a nurse and also as a new grad. I really learned a lot about like time, um, prioritization, my time management. I was able to use a lot of like my nursing skills in terms of like medication administration. I saw a lot of like, NG tubes, J tubes, worked with a lot of PIC lines, learned a lot about like different kinds of medications during that time too. And even like going in as like a new grad, it was kind of weird for me too, because I actually started out as like a charge nurse for like that facility, because at skilled nursing facilities, if you do have like a BSN degree and you're an RN, you're considered like a charge nurse over there. So it's kind of weird, coming in as like a young guy, becoming like a charge nurse and whatnot for like,
That's
for like the
crazy.
unit. Yeah,
Yeah.
it's crazy. And a lot of my colleagues over there, all the LVNs and nursing assistants, they're a lot older than I am. They're probably like, they've probably been in that facility for, more than I have, like for 10 years, 20 years. So they pretty much knew the skilled nursing facility in like the back of their heads. But, I got a lot of support from, like my supervisors and stuff, my nursing assistants and, LVNs over there. They kind of like showed me the ropes and helped me out, because for sure I was struggling. Like, I think one of the first units I worked for in the skilled nursing facility was like a 30-bed unit. And I was like in charge of all that. And I was passing meds to about 20 to 30 residents at a time. So it's crazy. I know a lot of people hear a lot of bad things about skilled nursing facilities and whatnot. I mean, it's some of it's true, some of it's not, but I think it's a good introduction into nursing, and it kind of pretty much built my career forward onto that. Especially during that time, people think like, oh, if you get like experience in a skilled nursing facility, you'll be stuck there, but it wasn't the case for me. I was still kind of like looking for jobs at the same time, that would accept me during that time, and fortunately, I actually got accepted into like a new grad residency program all the way in New York, for New York Presbyterian Weill Cornell Hospital.
Mhm.
So I pretty much ended up, moving to New York for about, I would say like a year and a half. And I worked for a med surg unit as well. And that's kind of like where I started getting like my nursing experience over there, and then ended up moving back to California and working for another organization for about 5 years now, also a med surgical unit as well. So that's pretty much kind of like how my my nursing career kind of started off. It was a bit weird, a bit bumpy. I know like it's not the traditional path where people like go to start on the med surg unit first or go to the ER or ICU, like what other people kind of strive to be. But if you do get the opportunity to work at a skilled nursing facility, I don't think you'll go wrong with that. It's gonna be, I would say, it's gonna be hellish and it's gonna challenge you for sure. Like there are times where like I wanted to cry at the end of the day because it was super tough. But yeah, that's all I can say about that. So
It's nice to hear that your story is not really the straight line that we would expect. Like right out of nursing school, we would think that, oh, okay, I'll apply to this new grad program right now and I'll get in and I'll start my nursing career then. But a lot of the times that's not the reality. Just like you, life takes you on different courses, right? And the course you took, it just brought you all back into the med surg unit, which is super cool because that's just like, how would you say, that's just something that was the goal, but it takes time to get there. I think a lot of nursing students really think that right out the door, you can find your first new grad program and then you're going to be placed into a med surg unit, which is not always the case.
Yeah, I mean, like my personal advice for like, all those nurses out there, especially new grad nurses, just be open-minded and flexible about like the opportunities, presented in front of you. Like you don't know like what that experience will, help you out in the future. Like I said, like with that skilled nursing facility experience, like I was able to be on top of like my prioritization and time management. And it was actually easy for me to transition into like the med surg units because at that time, you can get up to 4 to 5 patients and, you're juggling between those patients, but, dealing with like 20 to 50, 30 residents.
God, that ratio is insane.
I was actually really grateful for that. I was like, oh man, 4 or 5 patients, that's easy, So yeah. So yeah, definitely be flexible, open-minded. Don't be discouraged if, other hospitals like inpatient hospitals like turn you down. There's going to be a lot more opportunities down the road. So, don't give up.
So what are you doing now? So you said you were back in a med surg unit. Are you just a regular nurse or what are some of your responsibilities?
So basically, yeah, after I moved from New York, I worked for the VA for about 5 years now at the med surg unit. It's a post-surgical unit mostly, but we also do get like medicine patients, overflow and stuff. But I was on the floor for about 5 years. And during those 5 years, I actually got into more of like a introduction into like leadership. You'll probably learn more about it once you get into like the hospital, but I was actually kind of like my unit representative. The official title was like a shared governance council chair. And basically what I did was, basically how it goes is the shared governance structure, just each unit has their basically unit representative, and they usually meet once a month to discuss like any new changes that units want to implement in the hospital. If they see there's hospital processes that need to be improved upon, or there's a latest like evidence-based practice. So we kind of like bring that forward to kind of like the hospital-wide meetings to see what we can change and improve in care. And I was a chair for about I would say like 2 years, and that was a good introduction into leadership, into like a leadership role, because I was able to learn about basically kind of like my leadership style, being able to kind of like lead the unit, learn more about like evidence-based practices and like how to implement evidence-based practices and implement change in the hospital. So I think that was a good opportunity for sure. And, that experience actually led me into, landing an assistant nurse manager position and for the unit that I work for. And, I actually never actually, thought about even going into like leadership or like nursing administration. I was actually more like leaning towards, going to like the ICU or like going to the ER. But, being in a med surg unit for 5 years, like I kind of realized I don't really want to go into like ICU or, critical care or anything like that. So I thought leadership was another opportunity for me, another different path. So, I just kind of like took it, like rolled with it. At first I was like kind of reluctant in terms of like to an assistant nurse position role, because, well, for one, I was like, I don't know if I want that kind of responsibility.
Yeah.
Especially me, I would say I'm fairly still young, and like being able to be like a manager for a lot of these experienced nurses was kind of nerve wracking. But I actually got along really well with, like with all my colleagues and everything like that. And they really, pushed me and really motivated me to become, this assistant nurse manager. And so, I took the jump, and, now I'm in this role. In terms of basic responsibilities, I pretty much do kind of like more of like the operational side. And don't get me wrong, I would say I'm more 60% like administrative and like 40% clinical. I'm still on like the floor doing access stuff, helping out the nurses and stuff. I'm more of kind of like a resource for them in terms of like, if they need any help in regards to like policies or like procedures, I'm kind of there for them, and kind of updating them on kind of like what the latest, practices are for like nursing, how to use certain technology. I'm there to, help them and service them on that. Um, I'm also in charge of like, people's, schedules, doing like their timekeeping and all that. And then we also have the others, kind of like the leadership side of it. So I also deal with like conflict management, deal with like recruitment. So I'm part of like the interview process, and yeah, pretty much the interview and candidate selection process. I help with like all these projects that the hospital is implementing as well. So I'm able to like put my input on that and kind of be the voice for the frontline nurses in that respect. Um, and there's a lot of little responsibilities, but that's basically kind of like the gist of it.
Well, one thing that I wanted to kind of dive deeper into is that what you said about the 60% administration, 40% clinical, because I feel like when a lot of us nursing students, especially myself, think about nursing management, being in any sort of management role in nursing, we kind of think that, oh, it's like you kind of have to give up bedside completely. You kind of have to transition from bedside to management. But hearing from you in your case, that's not the case at all. Even though you still have this leadership role within your unit, you're still able to be at the bedside and still care for these patients. Can you talk about how that works? I know you said you're used as a resource for the other staff nurses, but what does that exactly entail? Like, do you have any patients that are assigned to you, or is it more just like you're on the floor supervising and people can just come to you whenever? Is it more like that?
Yeah, so it's basically kind of like that, like what you said. So basically, like, as a resource and whatnot, even as like an assistant nurse manager, I don't have like an actual like patient assignment. I would say I'm kind of more of like the kind of like a second charge nurse.
Okay.
Like like whenever they need help, like, I sometimes I break staff to, like, I break the charge nurse, or like if they're tight on staffing during that day, I would break other staff to help pass medications, help with nursing care in that regard. um, you probably don't get as much exposure to, like, practicing your skills, because you're also focused on like the operational side and going to meetings and all that good stuff. But I try to make it a point, like I try to round on like all my staff too, to make sure that they're okay, that they're not burnt out, or like they're not stressing out about something. So but yeah, usually if they have any like problems, like especially with like family members, or they're not unsure about any like policies or procedures on like what to do, or they run into any other problems, usually they come to me, and I'm able to like help them out, support them on the floor. Especially like with like family members, if there's like any difficult discharges, or like family members like complaining, or patients complaining, I kind of do more of like the customer service remediation. So I I talk to family members and the patients, see what I can do to help them out. um, so yeah, I'm not like fully like administrative. It's probably different in other hospitals per se, but I know like in my organization, like that's pretty much like what I try to do. I try to at least try to support my staff and show face.
Did you know that going into the job, like when you were offered or like when you applied for this assistant manager job, did you know going in that, oh, it was going to be 60/40, or were you kind of, or was it like this expectation that you had to give up bedside nursing for it?
Um, I kind of knew that it was kind of like 60/40. Even
Mm.
like the assistant nurse managers before me, they were like really supportive, and there was that kind of inspired me into kind of the role, because I really liked how they really checked up on me, really supported me on the floor. And I think that's really important, especially as like as a leader, or if you're looking for a manager, that they're readily accessible, especially when you need help. So yeah, so I like going into it, I thought that assistant nurse manager position was I think really, I guess, really motivating to go into that role, because I really want to do like more of the operational side, and at the same time kind of really help out my staff and like be a resource for them. So yeah.
Yeah, I think that's like the magic in nursing, that you have so many different options to choose from. Like how you said you were initially like you were in a sniff, and then you were in a med surg unit, and now you're a assistant nurse manager, which is awesome. You know, I think for a lot of people, at least for me in the beginning, I always thought that as soon as I get into like med surg, I'm gonna be there forever. But there's actually a lot of other options for us to choose from, and there's actually a lot more than just using your nursing skills in a med surg unit. You can do like what you said, like administration work, work more with the customer service part of everything, and actually help with the hiring process at the hospital as a nurse, which is really, really cool, because I feel like some people actually prefer that over doing all the actual nursing things. And now that you speak of it, it gives them like an opportunity to really think about what they actually want to do after they're out of after they get the RN, after they get their BSN. Like, oh, they can choose to, you know, pursue a career more focused on evidence-based practice, or um, a career based on just helping with nursing administration, because we actually do need that, in my opinion. Because from what I've heard and what I've experienced at hospitals, sometimes the nursing administration and there's just the hospital administration in general are just so bad. It's like, excuse my French, but it's so dog shit sometimes, you know. And it's just really unfair for not just the nurses, because the patients take the brunt of it. You know, if the nurses aren't happy with their job, if the nurse managers can't do their job correctly because of the higher ups, it's really hard to really give the appropriate care to your patients. If it makes any sense, you know.
Yeah, and I feel like it's, it's, I think it's really cool that, you still being at a young age, you're going into this management role, because I think, when you do have people that are more experienced but a little bit older, they might rely a little bit too much on tradition to carry out their practices. But now that, I feel like technology is advancing and we're getting more into evidence-based practice, we do need a little bit of that younger generation to, follow up and, spread that knowledge rather than just continuing, tradition, tradition, tradition.
Yeah, and also it's just that I feel like if we have a younger person in a higher administration role, they understand both generations. You can connect with the boomers and you connect with the zoomers. You know what I'm saying? So I feel like that is such an important factor when it comes to having good nursing administration.
Oh, yeah, definitely. Like, I mean, like I really appreciate like all the boomers and like all the senior nurses
Yeah,
out.
exactly. Yeah, they're awesome.
They're
Yeah,
awesome.
they bring a lot of experience to the table. I know, like for the most part, they're kind of like set in their ways, and I'm open-minded to that. I love learning from them, and even like even as like an assistant nurse manager, like I actually don't use like position title to really say like, oh, I'm better than you kind of thing. I'm just like more so to help there to like be a resource for them to really speak out for them as well, because most of the time it's like the senior nurses that I won't say they complain, but they bring up a lot of good like ideas, a lot of good issues that come into the forefront. And so like they bring a lot of perspective into kind of like the role and kind of like what happens, because they know more like than of course like your new grad and also like the newer nurses and stuff. But we also have like the new grad nurses and newer nurses who are kind of like more up to date on like current practices and like, technology. And as like a leader in as an assistant nurse manager, like my job is kind of like to help kind of bridge that gap, to see kind of like both sides and see how they can basically work together. And I think for the most part, it hasn't been a problem like on my unit. I'm not sure if it's a problem in other units, but yeah, for sure, definitely. Yeah, I mean
Yeah.
that's pretty much what I can say
Yeah.
about that.
One thing that you just said that I wanted to kind of dive deeper into it and just like emphasize is how you said that, it's the way you're so open and that you don't have to remind nurses that you're the leader in order to do something. I think that's super, super important as a leader, that, I feel like as a good leader, you don't have to remind people that you're the leader in order to get something done. It's more that, it's the way you present yourself, your openness, your mannerisms, that kind of convey that respect and that ability for even experienced nurses that are like double, triple your age to just come to you and, for help and for advice. And I think that's just awesome. Yeah.
Yeah, I mean, I still seek advice from all my senior nurses, all my experienced nurses. Um, pretty much I just make it a point. It's like, I'm here to help you guys out. I'm here to be your voice, even though you don't want to be in a manager position. I'm here to help you out. And like the senior nurses are kind of like leaders in their own way, and they're self-sufficient too. They help me out a lot with like in terms of like auditing, and like help me out in terms of like precepting nurses, and like helping out all the new nurses kind of get their experience. And they also help them out in terms of like what are the processes of like the hospital. So it's always good to have like that senior nurses or veteran nurses on the unit to help the new guys and nurses out. So
Yeah, I like that mindset because I think in a hospital, at least for me, having good communication with everyone and having a good relationship with everyone really builds that team dynamic, because you can't really take care of a patient just by yourself. It's actually a big group effort, I think. And when you talk about how you want to communicate with the older nurses and get their experience and really help you understand how the unit functions, it really ultimately benefits not just you and your team, but it benefits the patients.
yeah. Oh yeah, definitely. I know there's like sometimes nurses get a bad rap because of like
Yeah.
you hear stuff about bullying and like new grads being thrown like under the bus or like in water. Like I'm sure like it's true to a certain extent, but I would say it's not really like the case. I mean, for sure, if that does happen, like definitely bring it up to like your nurse managers, because you have to call people out on those certain things.
Mm-hmm.
But I think for the most part, like a lot of the new nurses, like if you're receptive to it, definitely kind of like pick out their brains. Definitely see kind of like ask them about their like experiences. Keep going to them, because they actually really appreciate that, like that you're seeking expertise from them. And that's kind of like how I built my relationship from there. Like coming as a new grad into like this med surg facility, like most of the nurses I worked with like were I would say kind of like in their 60s, like most of them.
Oh,
They've been
okay.
there for like a long time. And it's funny because like when I came into this role, a lot of them actually like retired. So you're kind of seeing that transition to like the generation and stuff. Like there's less of the boomers now, and like there's more of kind of like the Gen Xers and like Gen Y, and we also have like the millennials and
Mm-hmm.
whatnot. So you're kind of like seeing that transition. But yeah.
Yeah, and it sounds like your curious mindset is something that kind of has been developing ever since you started as a sniff, because you had the dynamic you have now where you're an assistant nurse manager, but you're managing some nurses that are older than you. You were already doing that way back when you were a sniff, when you were the charge nurse in your early 20s.
Yeah.
You're managing all these LVNs and CNAs. Yeah, I think I feel like you say that you've developed this leadership skill over time, and I think it just really shows through that whole experience when you had to jump into that leadership role right away, versus maybe in the traditional case that's not what it is. We're just new grads kind of learning from everybody versus managing everyone.
Yeah. Yeah, I mean, definitely like I mean, definitely I was like intimidated from all these like older
I can
nurses
imagine.
experience. But again, like the secret to that is just building a relationship with them,
Mm-hmm.
and
Yeah, I
always
agree. I
asking them
agree.
for help, and just being flexible, open-minded. Again, like sometimes they can be kind of like rough around the edges and kind of like be real with you. I think that's for the most part that's kind of like what senior nurses too. But don't take it personally. It's not
Mm-hmm.
just it's not like they're trying to bully you or anything like that. But I think they're really trying to really help you out, and they really want to see you succeed, because you guys are going to be the next generation of like nurses, and they really want to bring the best out of you. um, um, so definitely try to build a relationship with them, and try to ask them for advice, because they know a lot. So yeah.
Yeah, and one thing I wanted to ask you is your time in New York, because you were born and raised in San Jose, but then after being in that skilled nursing facility for 6 months, you decided to travel all the way to the opposite side of the U.S., and that's like a big commitment. That's a big step. Can you tell me a little bit about like why you decide to pursue the opportunity way out there, and how is it different compared to maybe like West Coast nursing? Because I know I've heard of
Yeah.
things. I've heard that there's
Yeah,
like a
like
difference.
I've
Yeah.
heard like there's a major difference between like East Coast nursing and West Coast nursing. Like sometimes we get a bad rep because we're always uptight, and then East Coast gets a bad rep because they're just so lenient about everything. Yeah, we do want to hear a little bit about nursing in the East Coast.
Yeah, sure. Yeah, I mean, at first, like going back to like Ryan's first question, like in terms of like transitioning to like New York. So I was born and raised in San Jose. Like I've been here for many years now, and like going to like a different environment, you know, it's definitely scary. And like being away from like family, even away from like my girlfriend at that time, like it's like, man, this is like a big decision, you know. But I just saw it like as an opportunity. I was just open-minded, even though it's scary. Like, you know, I just took a deep breath and, you know, just kind of rolled with it. You know, I just thought about like all the doors and opportunities that, you know, this experience will open up for me. And, you know, I just took it. And, you know, I thought it's like, oh, cool. You know, like if I had to work for, you know, any other city, I think it would be for like New York, because, you know, I heard a lot of good things about New York and, you know, how fun it is over there. A lot of things that go on. So, you know, I decided to take that jump and, you know, moved to New York for about a year and a half. It was definitely tough. It was definitely like a different transition. Like in California, they have ratios here that are designated by the state, but in New York, it's non-existent. So,
So wild.
like, yeah, so you can have up to like you can have 4 patients at a time, but like there were times where like it was so short that I got up to like 7 patients on a med unit. And again, like, you know, it was definitely challenging, but it wasn't something that, you know, I haven't seen before because of like my skilled nursing facility experience. But yeah, it was definitely tough, I would say. But you know, I really loved it there in New York. I really enjoyed my time. Like, you know, exploring a new environment. New York has a lot of good things to do over there. You probably heard about like their nightlife, all the historical sites there too. I would say it was kind of like a year and a half vacation for me, but at the same time, I was like, you know, working my butt off over there too. But again, like that kind of experience over there kind of like built upon like who I am and my leadership experience there too. And they definitely have like a different kind of personality, I would say, a different kind of culture. Like it's kind of hard to explain, but you probably heard in New York, I would say they're pretty blunt over there. So that's kind of like, it's weird because like for me, my personality, I'm more of kind of like an introvert, and I'm more of kind of like that reserved person. I don't really like to like start anything over there, but man, over there, you know, they'll call you out. Like if you do something wrong, they'll definitely call you out. And that's kind of like how they are. And, you know, I kind of learned to like that kind of like personality rather than like having someone like be kind of, you know, passive aggressive towards you, because you want to know like, you know, what you did wrong, even though it can be kind of like come across as like rude or mean, but that's kind of like how the New York culture is. Especially like with nursing there, man, they'll definitely like tell you what's they're definitely like real with you, I would say. And I think I really respected that because, you know, as a new grad nurse going in, I wanted to know like, you know, if I was doing things right, doing things properly. And, you know, I had really good good colleagues over there that really helped me out and really kind of refine like my nursing practice. So definitely like, yeah, it's a different kind of culture over there. And it's definitely fast paced too, as opposed to like California. It's true. Like California is a little bit like more laid back. New York is more like, you know, hustle and bustle. It's like all around there. So
yeah, that sounds very intimidating. Like as a 22, 23-year-old, kind of just scared out of your mind about like kind of learning everything that you need to be as a registered nurse. It does sound, you know, even though it's exciting, it does sound a little intimidating going into that sort of culture where, you know, you need to like get everything done, like where it's that hustle and bustle culture, and knowing that everyone who's gonna, you know, everyone is on your tail, kind of just seeing what you're doing and will call you out on it. Even though that's amazing, it's like at the same time, you gotta think like, wow, that is very scary.
yeah.
Did you move out there just by yourself, or did you know someone there that was able to help you get settled in and everything?
Yeah, so I mean, fortunately, like my uncle, he actually knew one actually like the nurse recruiters over there, and
Oh, okay,
Nice, nice.
yeah,
cool.
so that's like the main reason, kind of like how I got into
Yeah.
to go to like New York. So she was able like to hook me up, and you know, I'm definitely, you know, grateful for her for, you know, giving me the opportunity. But yeah, she was able to, get me an interview with like one of the nurse managers, and I hit it off with the nurse manager over there, and they ended up hiring me. So yeah, that's pretty much how it all came about.
Yeah, that's super cool because I feel like some people, at least that I know in in the nursing cohort, some might be afraid to really move out of their comfort zone to go somewhere that they don't know to get their nursing experience. And I feel like hearing your story, like it's inspiring me to really go out of my way and try to look for a new grad program outside of California, just so I could have that experience and then come back to California and practice my nursing here for however long I want. And now that I hear from you, I think we spoke about it last week. That it really opened up a lot of paths for me now, because initially I was always thinking about, okay, I'm gonna finish school right now, right? I'm gonna work 2 years wherever I can in California in a hospital that I want, and then maybe come out for grad school, right? But
Yeah.
when you talked about how you were able to find a new grad program elsewhere, and you're in a management position now, it's really just like inspiring for me, at least, to know that I can take multiple paths to get to the goal that I want to.
Yeah, I mean, for sure. Like, also, like, my personal advice is, like, if you have the opportunity to, like, go out of state, I would definitely try to go out of your comfort zone. I think it's scary, but I would say it's also kind of like exciting at the same time. Like, you don't get that opportunity every day to work at a different place, not have like much responsibility, especially like, as a new grad. You're, of course, you're not married yet. You're not tied to any other responsibilities besides, like, your family and stuff. But yeah, definitely take that opportunity, because, like, I think just moving to a different place, all by myself, I would say I learned a lot about myself, and like how I approach things, or like how I like looked at life in general. So I mean, yeah, so definitely, like, if you have the opportunity to move out of state, or even out of the country, like, I would definitely take that leap.
Yeah, I feel like, you know, that exposure to different kinds of people is super, super important, and it builds those skills, and I guess that tolerance, because you're saying in New York where everybody's kind of very vigilant, and
Mhm.
it kind of builds that thick skin. And I think having that exposure to different demographics is super, super important, because wherever you end up later in life, it's just going to help you that much more, knowing that you had that exposure to, oh, this type of people, this type of people, because then you can um, you can always kind of shift your, no, I don't want to say shift your personality, but you can always find something within yourself that can relate to another person, because I've been to this place, I've been to that place.
Yeah. Oh yeah, definitely. Like that kind of experience really helped me kind of like um, handle different kinds of personalities, handle different kinds of people, and um, you know, like, even before, like, even as like a new grad nurse, I was like really shy, really introverted. I didn't have a lot of thick skin, to be honest. But just going throughout like this whole like hospital, or this whole like course of like my career, I was able to build that thick skin, be able to learn how to talk to people, talk to, again, different personalities, and handle different situations. So I would say, like, it really prepared me for that.
Would you say like forcing yourself out there and putting yourself in situations that you wouldn't usually put you in helped you become a better nurse? Because I know for some people in the cohort, I know that like, same thing with you. I feel like they're a lot more introverted than extroverted, and they're having troubles to communicate with their patients, their own needs
Mhm.
and the needs of the patients. So do you think that putting yourself out there really helps you break out of that shell?
Yeah, I mean, definitely. I mean, like, I think the only way to grow is to really put yourself in uncomfortable positions. Like, you don't want to put yourself in a plateau. You always want to challenge yourself, and try to be the best as you can be. I know, like, people are afraid of like failure, and like being afraid of like making mistakes and not doing good in their job. But people have to start somewhere, right? Like, um, and I kind of go into that, like, whenever I go into something new, I kind of go into that kind of mindset. Like, even if I make a mistake, or if I fail, like, I can always get back up again, and learn from like those opportunities, and um, learn from like my mistakes, and just kind of build upon that. And um, you know, I did fail, and of course I made mistakes like going down the road, but again, it made me a better nurse. I definitely learned a lot from like my experiences. So, I mean, definitely like I don't think there's not anything wrong with like putting yourself in uncomfortable situations, and you know, I definitely like recommend those people like, you know, if you're kind of like on the fence about doing something new or putting yourself in an uncomfortable position, you know, just do it. Like
Mhm.
it's you know, it's not going to kill you. You know, I think it'll just, again, like you hear that quote, it's not going to kill, but it'll only make you stronger from then on
Yeah.
out. You never know what experiences will help you out in the future in your future positions, or what other opportunities they'll open up for you. So definitely, it's definitely like, you know, a risk that is worth taking, I would say.
Yeah, I agree. Well,
Yeah.
what were some of the experiences that really helped you, you know, break out of that shell and put you in an uncomfortable situation, but you actually came out positive from it?
Um, like I said, like with the skilled nursing facility, like going into it, I always heard about, again, like I said, like the nightmares about it.
Yeah.
You know, it wasn't something that definitely, it was definitely like challenging for me, especially again, like as a new grad nurse, you're all of a sudden you're taking care of like 30 patients, and then you're all of a sudden like in charge of like all these you know, senior nurses and whatnot. But
Hmm.
again, like even though it was uncomfortable for me, you know, I got out of it in one piece,
Yeah.
and you know, I learned a lot from that experience. So and it also introduced me a lot into like leadership as well, and like again, like how to handle certain situations.
Yeah.
So I would say that definitely, you know, has like a positive experience, even though like initially at first it kind of sucked for me, but I was able to learn from that. Again, also even in New York, you know, handling a different kind of like personalities
Mhm.
that I'm not really like used to. It definitely gave me a broader perspective, and also dealing with like different kinds of cultures, because over there, you know, they have a lot of like, you know, a lot of like Jamaicans. They have a, you know, it's
Is
less
there a
like,
specific story?
no, there's a different story, but yeah, there's a lot of like different kinds of
Yeah.
personalities over there. Like you see a lot of Europeans, a lot of
Yeah.
Jamaicans, a lot of, you know, other people that you would normally see them in California, because in California you see a
Mm.
lot of like, you know, the Asian population,
Yeah.
a lot of like the Latina populations here. So going into that, it was a different transition. So it's just like cool learning about like the different cultures over there. Um, but definitely like, you know, the bluntness of like New Yorkers, man, like being able to like, I don't know, it just, at first it was hard to be accustomed to that, having them just be real with you and like, you know, shouting at you at the same time. But you know, like again, like I really respected them, and I know what, I guess just being open minded to like what they're trying to, you know, tell me, the message that they're trying to tell me. I know they're trying to look out for me and like be a better nurse, and you know, I just took that in, and you know, I was able to like really build a lot of rapport and build a good relationship with my coworkers over there. So
Nice.
How was it like when you transitioned back to California? Like, going from immediately from one culture to the next. Like, do you feel like, rather than being surrounded by a lot of these people that are blunt, did you start becoming the blunt one amongst, the pack? Like once you came back to
no,
California?
no, actually, I wasn't like more of like a blunt person. Like coming back to California, I would say as it was pretty much like a smooth transition. You know, I would say
Because you're
definitely,
back in the Bay.
yeah, it was definitely weird just dealing with a different, you know, come back to Bay, and like dealing with more of like the more laid back personalities, more like, you know, sometimes, you know, there's more people who are like more passive aggressive, but again, you know, I was kind of used to that. I was able to handle that. But definitely like it gave me thicker skin in terms of like, you know, giving feedback to nurses. You know, I wasn't, you know, blunt about it, but you know, at the same time I was able to learn how to be like real when I
Yeah.
talk to like nurses, when I had to give feedback, because you know, some people are afraid to give feedback to other people because you know, they're afraid to like, you know, kind of hurt them, or like
Hmm.
perceive like a negative aspect to them. But I try to turn it into like a positive thing for them. It's like, hey, you know, even though you did this wrong, um like I wouldn't say like um sorry, but yeah, I mean, I just kind of let them know, kind of like, you know, this is, I kind of saw this as like something wrong, and you know, try to get turn into something positive out of that, like a learning opportunity for them. And it's not like me just being like saying that, you know, I'm better than them, but you know, again, just trying to help them in
Yeah,
terms of
more
like,
assertive, right?
yeah, just being more assertive, I would say.
Yeah, that's good. And then, you know, you kind of like mentioned a little bit about like once you did come back to California that you were working on this post surgical med surg unit, correct? Can you talk a little bit more of that? Because I don't feel like we really get that in nursing school too much about like that part of nursing. Can you talk a little bit about like your duties and you know what you learned from that kind of started building your skills to go on to the next thing?
Yeah. Um, so I can go back to like my med surg unit back in New York. So um, in that unit, it was primarily, I would say, like more so like the medicine aspect of it. I didn't really see a lot of surgical patients over there. It's mostly like, you know, patients coming in with like different kinds of like comorbidities. So like with, you know, diabetes, congestive like heart failure,
Mm.
a lot of psychiatric issues too. Even like special cases like patients with like sickle cell, like anemia, like I would get a lot of. Um, so definitely like I got most of like my medicine experience over there. And then, you know, coming over here, I got more of like the surgical side of like nursing for about 5 years. And I think I liked it a lot more. And I actually enjoyed it a lot more, especially on this unit. We have pretty much 11 surgical services. So like any surgeries that you can think of, you know, we do that kind of surgery. So, you know, we have like cardiothoracic where we do like the open hearts, we do like the valve replacements and whatnot. We also have major, you know, abdominal surgeries where we do, I would say like appendectomies. We also do cholecystectomies and all that good stuff. We also have like urology services, neurology. So for neurology, we actually do like craniotomies and we do like major back surgeries, all that stuff. We do plastic surgeries, um, and you know the list goes on. So I definitely got a lot of experience and a lot of I guess exposure to a lot of these different kinds of surgeries and how to take care of these patients. And basically the major difference between like the surgical side and like the medicine side, I would say the surgical side is more of kind of like being able to like monitor patients after surgery. That's kind of like the focus and kind of getting them back to kind of like their baseline level to kind of like what their daily life is. So it's kind of like more of like that rehab process afterwards too, and also like the care coordination afterwards also. It's kind of similar to like the medicine side of nursing, but like medicine is more so focused on like the workup and stuff. So you're gonna do a lot of like diagnostic tests, a lot of like detective work, pretty much to figure out like what's going on with the patient. But the surgical side is a little bit more predictable because you know like what they operated on, you know what you're looking for. So yeah, that's pretty much the main
And
difference.
like you know, you were
Yeah.
talking about like the medicine side involves some detective work, right? Do you feel like how much does nurse like how much can nursing like nurses do in that detective work? Because I think a lot of us imagine that you know we when we think of that we typically think of like doctors doing the diagnosing or you know yeah them talking to the patients while we're kind of just carrying out orders. But I feel like from what you're saying, like we do play a role in that detective work and still you know figuring out what is wrong with the patient. Can you talk a little bit more about that?
Yeah, definitely. I mean, like, you know, as a nurse, you're with the patient like for that 8-12 hour shift. And sometimes doctors don't have that time with the patient that you know, they typically would. And so you're kind of like the eyes and like ears for, you know, the doctors, like being able to like monitor the patient. Like, you know, you're looking at their labs, you're looking at the overall picture, like the overall assessment and stuff. So, you know, they're, and it also comes with experience too, but sometimes you feel like, oh, like there's something wrong with the patient, let me explore that. So you know you can start to do like look into doing more focused assessments on the patient and looking more into kind of like their clinical history, look more into like the lab results and kind of figure out, oh, you know, this is, I think this is no, I think this is, maybe it might be cancer, it might be something else. So um, even though you can't really make that diagnosis, you can kind of like discuss that with the primary physician taking care of that patient. It's like, hey, you know, I think you might want to look into this. I suggest maybe doing like a CT scan or like an MRI or you know drawing this type of lab. I think you can definitely do that kind of workup. So I would say like nurses can actually make that recommendation, I would say, and collaborate with other interdisciplinary team members. So I mean, I would say nurses definitely have like a voice and definitely have a place in terms of like that detective work, because they see like subtle nuances that the patient might be experiencing that they normally wouldn't. And so being able to like report that to the physician and being able to like recommend kind of like what the next steps are, I would say that's definitely one of like the nurse's like major role. Yeah.
Yeah, and just like as we're nearing somewhat the end of the podcast, I do want to talk about, your current role now as like the assistant nurse manager, particularly, the hiring process, because, you mentioned that you were part of that hiring team. And I think that's what a lot of, viewers, especially seniors, want to like get a little insight on, because, I imagine, when you first started out too, I imagine like how scary it is to go through that hiring process, interview process. Can you shed some light on that?
What about it specifically? Are you talking more of
Um,
like interview or like resume or like?
I think first I just want to ask you about something, because like after talking with a bunch of new grads,
Mhm.
I've kind of come up with this, assumption that people have been telling me, where like once you get past the resume stage, like once you've kind of gotten that interview, a lot of people have been saying that, you shouldn't really be concerned about being qualified, because if you've passed that stage, you're qualified, and that they're looking for, you know, more of kind of how you fit into, your unit, into that nursing family. Is that
Okay.
is that a correct assumption, or?
Yeah. So like pretty much, yeah, once you get kind of past to like that resume stage, because you want to for sure like that the first resume screen, they're just want to make sure that you're meeting all the qualifications. And then, once you get into the interview process, I would say like it's more less about like your clinical knowledge and whatnot, but it's more so about getting to know more about the person, about their experiences, what they bring to the table, and also like about their personality, because that's a major thing. Like how are you going to fit into like the organization, and how are you going to fit into the unit, because it's for sure like a unit already kind of have like this established culture, and you want to be able to hire someone that is able to like fit into that kind of like culture and also fit into that kind of like team as well. So we definitely like look for like a certain type of personality. And I know like even other organizations like that you're going to be like working for, or even outside of nursing, they're looking at like the personalities. Like even some organizations are doing like personality tests and whatnot.
Oh,
Oh, and that's interesting. So they're
Yeah,
actually taking a look at
interesting.
that personality test that we all taken, right? Like in psych or something. That's crazy.
yeah, it's crazy. I don't know if that's actually true in like some like different organizations, but I've heard about that. But
Mhm.
yeah, we definitely are looking for someone who's um, always open-minded to like growing, someone who's definitely positive and willing to be involved on the unit, someone who's a team player. So we're kind of like looking for those specific types of like personalities, because yeah, again, like that's important. And also someone who can um, be able to like handle stressful situations and whatnot. So those are kind of like important characteristics. So we're kind of like seeing basically how they're going to fit in, and also how they're going to handle like the patient load on the floor too. Um, so yeah.
But like, how do you find that out? Like, what are some of the questions that you might ask to kind of get that out of the person you're interviewing? Because I can like, because I don't like how do you do that? Like, how do you like kind of determine like how much stress they can handle, or like the type of personality they'll have on the floor, just through like a couple questions during an interview?
Yeah, so basically like how to handle like stressful situations. Like we more so ask for like examples. So it's like, oh, how would you prioritize this? So you have again like two difficult patients at the same time asking for different needs, and like how would you prioritize that? Like one is asking for like pain meds, at the same time other one's like having they want more attention because they want to be discharged right away. Like how do you handle that situation? And you kind of look at their examples, how their experiences, and how they react to that situation. Also like how do you handle like stressful situations? So like for example, if you had a patient who ended up coding or whatnot, like how did you what did you do to approach that situation? So kind of like seeing like how would they yeah, basically handle the situation, give us kind of like more insight of like their personality and their way of thinking. And um, it also helps us like analyze, okay, I guess this person's like ready to be on our floor kind of thing, if they're able to, handle that that level of stress, or like that level of like prioritization and critical thinking. So yeah.
Interesting. Yeah. I just feel like I don't know. I feel like that's so useful just to know, even like as a junior, like as Alan and I are just kind
Mhm.
of closely approaching, that stage. Because I think there's always this fear that a lot of us have that in order to get the job, you have to be like the best person amongst the candidates. But I think from what you're saying, like, you know, uh, you don't necessarily have to be the best, but you do have to have certain characteristics about yourself
Yeah.
that are useful for when you are on the floor as a nurse. And it might be different from unit to unit, right? And yeah, I
Yeah.
think that's just super useful to hear.
Yeah. So like, I mean, we definitely really look into experience too, but like definitely really want something, someone with character. I know like in interviews, people are looking for like the ideal answer, but we're looking
Hmm.
to like, again, learning more about the person, how they handle different situations. Because for sure, like people can do like nursing skills and whatnot, but you can't really teach someone, how they react in certain situations. Like the person.
Yeah, the people skills, the people aspect of nursing,
The soft
which is
skills, yeah.
just as important as all the skills that you learn. Yeah, just I feel like nursing is a lot of it's just customer service too, really making the patients feel okay and making your teammates feel like they belong over there, and make them feel appreciated.
Yeah. 'Cause I mean, like, like when we think about it, we're gonna be hiring someone that we're gonna work with. It's like,
Hmm.
and you think about like, oh, do we really want to work with this person?
Yeah.
Especially like if they're like, cocky, or like, uh,
Hmm.
especially if they're not open minded or anything like that. You're gonna run to like conflict with them like on a daily basis. So, we try to avoid that as much as possible, I would say. So it's, we're definitely looking for someone that we for sure want to work with, and want to have a positive relationship with. So that's kind of like what we kind of like look for in like the interview process.
But
Cool.
how about before the interview process? Because I think, yeah, like, because in order to get to that interview process, you have to be, what a lot of you guys consider a qualified applicant. But what does that really entail? Because, all you have are like a couple of short answers, you have a resume and like and a cover letter. Like, how do you guys kind of pick out those people for the interview amongst the hundreds or even thousands of people?
Yeah. I would say it's a bit different per like unit. Like I would say like just speaking from my experience, like specifically like on med search floor, like when I screen resumes, and we look over a lot of resumes too. Like I
Mhm.
think in this last I think we just interviewed like new grads and whatnot. We had like 215
Ooh,
applicants. We had to look
Oh, that's a
all that.
lot.
So basically, we look over like preference. So if people have like a personal preference, like if they want med surg, then we kind of focus on that, since they, if they want med surg, right? And then once we screen them, we kind of look at like their experiences and stuff, and like their clinical preceptorship. So we kind of look at like, okay, they did their senior preceptorship at a med surg unit.
Hmm.
So we kind of look into that. And then we kind of look at kind of like what their past experiences are. So actually, I don't know if I'm personally biased, but I also look for patient or for people who have like some kind of like nursing experience, like either at a clinic or a skilled nursing facility and whatnot, because I know those nurses are pretty much mentally prepared to go to the next level and work
okay.
on a med surg floor. So having some kind of like nursing experience or background, definitely helps. Um, Even some kind of like leadership experience, whether it's like in college, or like um, whether it's in like your job too, like that's something that we also like look for. And also like different kinds of certifications, because we want to know what you kind of like did during, or I would say not did during kind of like your downtime, or while you're applying for jobs. We want to see like if you've gotten like your certifications in like ACLS, or like your you did like EKG interpretation classes, or like you did like the NIH stroke scale. So I
Hmm.
would say like, you know while you're applying, I would definitely suggest people to like look into getting certified for like certain things like EKG, ACLS, all that stuff, because that really matters. Because I think most facilities now are accepting mostly like ACLS certified nurses now too, and they also look for some kind of like EKG interpretation. So yeah, definitely something that we would put on your resume.
Okay. And I'm just curious because do you feel like hiring managers are going to be a little bit more considerate, flexible, or just approach things differently because of the pandemic? Like people who are going to be applying in in the next semester or in the next year, do you think it's going to be different because some of those opportunities for internships, jobs, volunteering are going to be shut down? Do you think it's going to be a different approach?
Um, to be honest, I'm not sure, but like I would definitely say like we're a bit open minded. Just speaking personally for me, I know it's been challenging for a lot of students. But yeah, I mean, I'm not sure how other managers are going to approach this kind of situation. So I can't really tell you for sure how it's going to really impact like the hiring process for those people who got to deal with that pandemic and stuff. But again, I would say it's how I would say new grads kind of respond to that. Like, even though they didn't get that, clinical preceptorship like experience, like what did they do after, like did they volunteer for like, were they able to get a job at a clinic or like, help out at a skilled nursing facility or, do something. It's just after the fact. It's not like, being, um, I would say, um, yeah, it's just basically how they responded to that situation and how they were able to kind of like get their experience in.
Okay.
So, yeah.
Yeah, just to close out the podcast, really, we just want to hear a little bit about what are some like your future goals, or what do you have planned for the future in your nursing career?
Yeah, sure. So actually currently I am going for my master's degree. I'm actually doing a
Okay.
dual degree, master's in nursing and also a master's in business administration as well, with a focus in nursing administration. So I mean, I'm trying to look for more opportunities in kind of like a leadership role, potentially becoming a nurse manager maybe. I'm not sure if I really want to get into like a chief nursing position, but
Yeah.
I'm also like interested in, originally I was also interested in doing like nursing informatics, which is more of like the data information technology side of like nursing. Because I'm more of like a tech guy. Even like before like going to nursing, I really wanted to do like computer engineering or some kind of engineering. So I think like going into nursing informatics, I get the best of like both worlds. And I don't know, even though I'm doing like nursing administration or also getting my master's degrees in business administration, um, you're still gonna need that kind of like knowledge and experience going into like a nursing informatics role because you kind of have to know, the ins and outs of like the processes that go on in the hospital, how the organization works, if you're gonna implement, new technology or like if you're gonna, gather data and whatnot. So I think like this kind of degree that I'm going for will definitely help me prepare for that kind of path or wherever I'm trying to go in nursing. So yeah.
Yeah. Just like I said before, there's just so many things to do in nursing. It's
Yeah.
crazy.
Yeah.
It's
Yeah.
so crazy. Like how you were saying like, oh, you were initially like going to college to be an engineer, but now that you're after nursing, you're like, oh, okay, I can get the best of both worlds and really do nursing informatics, what you want to do initially, and it incorporates what you learned from nursing, which is so cool.
Yeah. I mean, like a lot of people like outside of like nursing really just view nursing as like, oh, you're doing
Yeah.
like bedside work, wiping butts and all that good stuff. But like these past several years, nurses have gained like a lot more responsibility, a lot more power, and like in terms of like in like leadership roles.
Mhm.
So you can go into like again like nursing administration. So you can go into like a leadership role and your organization. You can go into like informatics, which is tech side. You can go into like consulting for like ethics, for legal concerns, for safety and whatnot. So there's definitely a lot of different like opportunities for nurses out there, not just just clinical. But yeah.
Yeah, and I think, just from hearing your entire nursing journey, it just really goes to show you that, you know, you kind of have to roll with what you have and take the opportunities and take those risks, because you never know what you're going to like or be passionate about until you really experience it. Because you might have had a set plan or this
Mm.
idea of what you want to do as a new grad or like as a senior in nursing school, but I can imagine you might not have known a couple of years down the line that you'd be doing this, but here you are now, happy with what you've done because of all the things you've experienced.
Yeah, I feel like that's like the best way to grind in nursing too, because if you get into something that you're not that passionate about, I feel like you're going to get burnt out a lot quicker than if you were to be in something that you actually tried out and it's tried and true, right? Where you've experienced it before and you actually really like it. Rather than just going to something and you're like, oh, you're so indifferent about it. You're always like dreading to go to work. It's just a lot, like that experience is just so much more different.
Yeah, I mean, definitely, like, going like when I was applying for jobs, like I really want to go into like the ICU and like the ER and whatnot. But like now I'm just like, I don't think I want to do ICU and ER anymore.
Yeah, because
So I kind of like med surg nursing, and like I'm pretty comfortable with that, and I like the surgical side of nursing as well. So that's a reason why like I kind of stayed with like my unit, um and yeah, ended up getting like a leadership role in it. So
yeah, because you dipped your toes in a little bit of everything,
yeah.
like you tried a little bit of everything. You found like, oh, this is the sweet spot. I really want to do this. I'm just gonna do nursing administration. I really love doing my job as like assistant nurse manager, and I want to go into informatics because I think it's beneficial not just to me but to everyone else that I'm working with, which is really really awesome.
Mhm.
Yeah, yeah, that was an amazing podcast. Thank you so much for being on as a guest. That was awesome. I think
Yeah,
both Al and I have learned so much
Yeah,
as you did, the
honestly.
viewers. Oh gosh.
well, I'm glad that you guys gave me this opportunity to just be part of this podcast and be able to
Yeah.
shed some light and help out future nurses. So again, like I'm really grateful for you guys, and I'm really thankful. So thank you guys for this opportunity.
No, thank you. I'm super enlightened from the
Oh yeah,
conversations we've been
for
having
sure.
for
Yeah.
100%. And I can say the same for the viewers too. It's just that we really wanted to do this podcast because we wanted people, not just the MSNS, but whoever has a chance to listen to the podcast, get experiences outside of what they're learning in clinical and what they're learning in theory courses. Because I think in the real world, a lot of the experiences you get are a lot different from what you've been learning at school. So thank you so much for taking your time and really having a great conversation with us.
Yeah, of course.
Yeah,
Thank you,
yeah,
Ryan. Thank you, Alan. Appreciate it.
of course. And always a special shout out to the viewers that watch the whole podcast all the way through. We really, really appreciate you guys and hope you guys have learned so much. Thanks again.
All
And
right, signing off.
yeah, see ya.
See you guys.